You are watching the DocTalk show.
We are discussing hepatitis B, and with me in the studio is our guest doctor, Dr. Mon Jackson from the Uganda Ministry of Health. There are some groups of people who are at high risk of this virus.
Yeah, no, when we are talking about hepatitis B, we have mentioned the routes of transmission. And definitely there are some people who are, as they do their work, they get in contact with either the fluids or the blood of suspected or confirmed patients with hepatitis B. And this may include our health workers. They're really at risk. So we always think that they should really protect themselves as they are doing their normal duty of providing the medical service to the patient.
And that is because of using the needles
yes,
and the
using
sharps.
the needles, they can prick themselves, so they really need to protect themselves very well. Or even touching the blood or the fluid of patients who are infected with hepatitis B. Two, we look at our armed forces. You know, usually when they go in their normal duty, they may get in touch or in contact with the fluids either of people when they are doing their normal work. I don't want to go into the details, but the armed forces, they're also at risk. Then the other people who are also at risk are the sex workers. Those are people in any type of sex workers. They can get in contact with the hepatitis.
Because it's also sexually transmitted,
Because
like
it's sexually
HIV.
transmitted.
Yes, so, and it's not only just sex workers. People who engage in unprotected sex
That's true.
are at risk of getting the hepatitis B.
The sex workers or even people who have multiple sex partners, they can get they get hepatitis B. And as I say, the mothers who are infected and during the process of giving life, they can transmit the hepatitis B to their unborn children. So these are the people who are really at risk, the unborn children. They can really be at risk of getting hepatitis B.
Yeah, I want to talk more about the mother-to-child transmission. Because according to the research in Uganda, they show majority of the people who have chronic hepatitis B have had it since childhood. That means either they acquired it from their mothers or sometime in their childhood from other children.
Yes.
So why is mother-to-child transmission so important in this context?
Yeah, when we rank the transmission, we find that mother-to-child transmission is very high. And when you look at families who are having patients with hepatitis, you may find maybe in the whole family. And the common route which we now think it is from mother to child. Because hepatitis cannot be transmitted by touching somebody. You cannot get hepatitis B by eating from the same source.
Same plate.
So the thinking that because you stay together you can get hepatitis B is not true. The only way what we think you can get is the surest way is from mother to child. And if you have a family with very many children with hepatitis B, that is the commonest route. But the second one, which I told you also, when children play together, they can be sharing the saliva. So from child to child, you can also commonly get in a family where people are playing. That's innocently they begin touching their saliva and putting in the mouth of the other. So if one child has hepatitis B, which could have acquired from the mother, can transmit to the other child who is hepatitis B negative.
What has the government done to curb this hepatitis B problem?
Yes, the government has realized this very early, that in the year 2002, the Ministry of Health came with what they call the pentavalent vaccine. And one of the vaccines is for hepatitis B. So by 2002, we started giving that vaccine. And the only issue that we give is we give it after about 6 weeks.
Yes.
Which we think it may be slightly late. But the program which could have really worked is if at birth the child get the vaccine for hepatitis B, so that by the time you come to the first dose of the pentavalent vaccine would be like a booster dose, and that would have a big effect on preventing this hepatitis B transmission from the mother to the child. But we have been working so that we have been trying to prevent the child who has got already transmission from the mother to getting into chronicity. And as I said, the acute form is from 1 to 6 months. So when you begin the vaccination at 6 weeks, we still hope that it can prevent the child who has that hepatitis B infection from moving from acute to chronic. And this vaccination has been going on, except that there are many people who may not go for the vaccination. So when you don't get the vaccination, then the child will now grow from the acute form. If he has acquired hepatitis from the mother, will continue growing into the chronic stage. And then that's the complication that will come. But the Ministry of Health has put that in place since 2002. So we have been giving the vaccination for hepatitis B.
What's most important is people understand the role of vaccination and its importance, because when someone gets vaccinated, they achieve complete immunity. In majority of the cases, more than 95% of people will achieve lifelong immunity against hepatitis B. So this means the moment you receive your 3 doses, because the vaccine is given in 3 doses, after receiving your 3 doses, you obtain what they call lifelong immunity against the hepatitis B. So if you have a child, take your child for those 3 shots of hepatitis B vaccination, and your child will be guaranteed protection against the hepatitis B infection.
That is what I want our viewers to understand, is when you talk about this protection or immunity, is exposing the patient to a low dose of the same infection. And the body now recognizes that if this infection comes, I'm going to protect the body like this. So that protection is what we refer to as the immunity. The body now is able to protect any other infection. And that one is only when you vaccinate the child or an adult. And then that is how we can protect our population.
Okay, so after the break, we shall discuss more about prevention of hepatitis B in adults. We have mainly focused on children because of the importance of the vaccination and the national immunization program. So after the break, we shall discuss prevention of hepatitis B in adults, and which people, if you are infected with hepatitis B and it's in the chronic state, which people should receive treatment and which people shouldn't. So send in your questions and comments on our social media platforms, and our doctors will ably answer all of them.
You are watching the DocTalk Show.